Hi, everyone. We're going to get started here. Thank you so much for joining us. You're in for a real treat, pun intended. We are talking about the intersection of food waste and food as medicine. So maybe not a lot of you know, maybe not a lot of you care, but in a past life, I moonlighted as a holistic nutritionist because I myself had some health issues and started to learn about the power of food as medicine. And so this is a really special conversation that we're about to have today. Something that I shared with the panel as we were prepping for this conversation is, yes, food as medicine has kind of been in the mix at the summit in the past, but we've really never had a concerted conversation and planned for a conversation like a panel as we're about to hear. So I am really, really excited for what you're about to learn, what our panelists are about to share, and obviously you all likely have things to contribute to the conversation as well. So I do welcome you to the Q&A section, which will happen at the end of this panel. So without further ado, I'm just going to introduce our amazing all-female panel that we have. Thank you. Absolutely. I mean, we could, yeah. But so, yeah, first we have Wendy. Wendy, if you could wave. Yeah, we have Wendy. She serves as the Associate Vice Provost at the Semel Healthy Campus Initiative Center and the Clinical Professor at UCLA School of Medicine and Public Health. She is building an inclusive culture of health for UCLA's community so that they have a chance to thrive and flourish. Her journey really, though, began with international work as a primary health care coordinator with Save the Children in Africa, South America, and Asia. She's also had roles as a clinical faculty member with WellStart International. In addition, her clinical practice she's had a clinical practice in pediatrics and has been instrumental in integrating nutrition education into the training of health professionals across disciplines at UCLA, which I think we all agree is really important that they're receiving nutrition education. Next, we have Emma. Hi, Emma. She is the National Director of Healthcare Without Harm. She has a career that over the last 25 years, I believe, has been building a better food system. Her current role is leading a team of content experts and organizers to engage the healthcare sector, to use their economic, social, and political influence to support healthy, sustainable, and equitable food systems. So welcome, Emma. And then last but not least on the panel, we have Dr. Lara Ramdin. She is the Chief Innovation and Science Officer at Upcycled Foods, Inc. She helps to revolutionize, oh my goodness. I'm gonna skip that word, you know? That's a buzzword anyways, right? What does that mean? She's working on, obviously, food systems work and integrating upcycled practices into, and also food sovereignty into the work that we do. She helps to transform undervalued byproducts into high-quality, nutrient-rich ingredients. And obviously, that is supportive of holistic health outcomes, which I'm sure you'll hear much more about. And last but not least, we have our fearless moderator for the panel. That is Melissa. Welcome, Melissa. She is the founder and CEO of Planet Harvest, which is revolutionizing, thank you, the way people enjoy fresh produce. And that focuses on refining supply chains and introducing rescued produce to consumers. She also has served as the president of the Produce Alliance. She serves currently on the advisory board of Freight Farms and most recently joined Brighter Bites board, which I remember as a grantee of actually ReFed. So it's nice to have that connection. You have more than 14 years of experience working in the produce industry, which is one of my favorite industries. So good luck on the panel. Thank you all for joining us, and I'll leave it with you.
Amazing. Well, this is very exciting to be able to have a room full of people interested in food as medicine. And we've been at so many different conferences where we take this from one angle or another, but to be at the intersection of the food rescue missions and the food as medicine is super exciting. I'm just going to read you a few highlights from different articles. For some of you may have different information and different knowledge of what food as medicine is and where it's been in the last 2 years. So food as medicine, so health insurance should cover it. Is food as medicine the future of food? Fruit and vegetable prescriptions may lead to better heart health. The U.S. government has backed food as medicine movement, but does it have staying power? As we can see from these headlines, like food waste, food as medicine is a hot topic in today's world. The movement of food as medicine emphasizes the idea that food can play a crucial role in preventing and managing chronic diseases and promoting overall health. This approach integrates nutritional science with medical practice, highlighting the therapeutic potential of specific foods and dietary patterns. There are ancient roots of this movement from civilizations like the Greeks and Chinese, but a resurgence in the interest has occurred due to rising health costs, increasing rates of chronic diseases, and a growing body of scientific evidence supporting the health benefits of certain foods. But why are we talking about food as medicine at a food waste summit? By harnessing the potential of excess food, the food as medicine movement can further its goals of improving public health, reducing healthcare costs, and fostering a more sustainable, equitable food system. Our esteemed panel today will discuss how they are involved in this movement, what solutions they are working on, and where they see the future of this movement going. Personally, I'm involved in food as medicine as part of a solution for the fresh supply chain. After 12 years in the produce distribution industry, I left my family business where we supplied the leading food service companies across the countries. Think large coffee shops, quick service restaurants, and hotels, and took my learnings, my network, and my focus to work on supplying the freshest produce to the food as medicine programs. My business today focuses on supplying and curating boxes that are delivered directly to patients' doors through insurance and healthcare companies. In addition, I'm working on pilots and partnering with UT Health, Harris Health, and Brighter Bites, and DoorDash to help scale the food as medicine movement for high-risk pregnancies patients nationwide. Okay, enough about me. Let's now get on to our panelists. First, I would love for each of you to give us a little introduction of yourselves and also tell us about the work you're doing within this movement and the cross-section.
Well, thank you, Melissa. And I have a few slides. I can't help myself as a professor. And I also want to say how honored I am to be here, and also want to thank Chuck Sabat, who's one of the board members of ReFed, for inviting me to be part of this group. I'd like to start with, let's see if I can do that. Oops. Do I press it? Oh, that one. Thank you. As a pediatrician, I've been asking my whole career this question: how do I integrate food into my practice, research, community, and advocacy, so everyone has the food that will allow them to live a healthy, dignified life? Oops, back. And I was invited to join a mission and vision that answered just that question, otherwise known as the Semel Healthy Campus Initiative Center. The goal was simple: make UCLA the healthiest campus in the US for the 85,000 students, staff, and faculty, and inspire others. And it did not take long before UC then President Napolitano announced the Global Food Initiative in 2014 and the Healthy Campus Network in 2016, translating our UCLA model to the UC system. We took a two-prong approach. We took an asset mapping and mobilization approach. Our aim was to build on the strengths of anchor institutions. And we asked ourselves, who and what drives health for the university community and beyond? Utilizing the socio-ecological model, we answered these questions, and you can see that in these spheres, with our students, staff, and faculty at the center. So how do we mobilize these assets? We used a collective impact strategy, sort of like what Secretary Vilsack was talking about this morning. We tied everything together. We brought people in together into a room to meet regularly, leaving their personal agenda at the door, agreeing on a common goal, and we met regularly around certain topics. And we built trust, we built relationships, and action happened, literally silo busting at a university setting. Now I'd like to give you an example of how we did this. Again, taking the ethos of tying and knitting things together. We addressed food insecurity. We brought people together. We knew this was a problem. Ever since 2009, the Great Depression, we started to have a food closet on campus. We heard anecdotally some students were dropping out from school because they didn't have enough to eat. They were losing their houses because they were choosing, or they weren't eating because they were keeping their apartments. They had to make choices like that. And so we said, what's going on our campus? So we collected a group of stakeholders across the entire campus and started meeting regularly. And we identified that we didn't have any data. So we put some questions into our regular annual surveys and found in 2014 that we had very high rates of food insecurity among our graduate and undergraduate students. And since then, we've been doing these measurements, and as you can see, we still have very high rates that will include the ones that we have here in 2022 and 2021, where we can see 35% of our undergrads and 20% of our graduate students are food insecure. And if we don't deal with food insecurity in college, it persists through adulthood. So how do we take on this issue of food insecurity? Well, we wanted to listen from the stakeholders. What can we do about it? How can we solve this problem? So we started doing focus groups with our students. And we identified that the students, yes, they wanted healthy, delicious food, but they also wanted to learn how to cook and how to prepare economically food that tasted delicious. And so what that focus group gave us was the impetus to find a donor, a place, and build a teaching kitchen on our campus, the first teaching kitchen on our campus in 2019. This teaching kitchen allowed us then to also look for other things that our students wanted, which was education and also to fight for food justice. So we started a food justice course. And with that food justice course, we created community partnerships. And one of our strongest community partnerships is an organization called Food Forward that just this last year has gleaned over 80 million tons of fresh fruits and vegetables and delivered it to different food banks, and also we delivered it to our own campuses. And you can see here a picture of the grad students collecting on a weekly basis with their kids some of the fruits and vegetables that were gleaned at farmers markets through the Food Forward partnership. This partnership also allowed us to introduce Food Forward to a clinic where I've worked for over 20 years called Venice Family Clinic, a federally qualified health center, where our practitioners, including our trainees, who are pediatric residents, family residents from UCLA, are giving prescriptions for fruits and vegetables. And then on every Tuesday of the week, each Tuesday, patients can come to our clinic and pick up those fresh fruits and vegetables that are donated by Food Forward. This is a full loop, again, knitting all these different resources together to create not just opportunities for our students, but also for our community members, like our Venice Family Clinic. So as we all know, it takes a village, and this is an example with the Live Well sign, which is our Healthy Campus Initiative emblem, and all the partnerships that we've created, and many more that aren't even visualized in this image, for us to really bring our mission or vision to create a healthiest campus in the country. And I just want to express gratitude to all of you for coming here to listen to what we've done so far at UCLA and beyond. UC-wide is now doing the same kind of work, and I look forward to this panel. Thank you.
Too many technology pieces here. Let's see. Well, thank you for having me today. So my name is Emma Sirois, as I was introduced, and I work with an organization called Healthcare Without Harm, and our membership body called Practice Green Health. And actually, UCLA and the entire UC medical system is within our membership. So this is a great example of a healthcare entity that we work with. So Healthcare Without Harm is actually a global entity that was founded about 25 years ago. Our mission is to transform healthcare so worldwide so that it reduces its environmental footprint and it becomes a community anchor for sustainability and a leader in the global movement for environmental health and justice. And so within that context, we do research, we do demonstration work. We also then work to scale the best strategy that we've identified through a network here in the U.S. called Practice Green Health. Our Practice Green Health network is about 1,700 hospitals, and that, to give you a perspective, that's about a third of the hospitals in this country. We have a little under 6,000 hospitals right now in this country. And so that scaling strategy then can lead also to policy action and using the voices of and the kind of political influence of the healthcare sector to create regulatory and policy change. So that's kind of how we work. And in 2005, we launched our Healthy Food and Healthcare program. And so, we've been working on food for a long time. And in fact, the first project that I worked on with Healthcare Without Harm, and I've been with them since 2007, was actually a composting project, working with local hospitals, getting them to compost. And it's interesting because at that time, the rationale was you don't have to pay for composting. So it'll be cheaper if you compost more and trash less. I'm so excited that this conversation has evolved, and we have entire sessions on methane emissions. So it's exciting to see the evolution. But when I was asked about sort of food as medicine and how that fits into your work, food as medicine as a term, has a really broad application right now. At a very in its specific application, it could be produce prescription programs or places where you're prescribing food for health. But it also is being used to talk about all sorts of different interventions that really make the connection between what we consume and how we produce it, and our health as both as people and the health of our environment that then turns around and impacts our public health as well. So the way we have applied sort of this term, food as medicine, in our work, it really is a good frame for the work that we do. We work with hospitals to help them think about what they can do within their walls, but also what they can do within their communities. And here you see some examples of the kind of within the walls applications. So we do a lot around food purchasing, helping hospitals think about how to preference foods that have had a lower environmental footprint, have supported community wealth generation, address animal welfare, et cetera, local food systems. We also work with them on really thinking about what they put on the plate. And so how can you reduce the emissions from your plate? And the best way to do that, or the most expedient way of doing that, is to address animal agriculture and using animal products. And so we have a couple of programs that we run in that space. And the Cool Food Pledge you may be familiar with. So we're the operator of the Cool Food Pledge within the healthcare sector. And then lastly, in this space, we have a robust reducing food waste, food loss and food waste project. And we have resources around that, and we're actually we're just working with ReFed and World Wildlife Federation to define, to bring the healthcare sector into the U.S. Food Waste Pact, and we'll be announcing that shortly. And so that's a really exciting evolution, and we think something that, an opportunity to really create more accountability in the healthcare sector for food waste reduction. And then this conversation about food as medicine really ties in well. It bridges the gap really between the inside the hospital and the outside of the hospital walls. We have for years worked with hospitals, nonprofit hospitals that have community benefit obligation, and given guidance on how to leverage that opportunity to address healthy food access in your communities. And so some of the food waste solutions with recovery really fit into that space, right? They create linkage between what otherwise would go to waste in the kitchen and connect it to community through recovery operations. And so that's a big piece. And I will stop there and hand it over, but that gives you a sense of who we are, and I invite you to connect with us.
Hello? Yes. Hi. I'm very honoured to be on this panel with two such esteemed individuals from healthcare. So I offer a slightly different alternative to food as medicine because I'm at a different place in the food system. And actually, my daily job is to deal with food waste, and specifically waste that comes from the manufacturing process. So if you go to Refed's Insight Engine, which you should if you haven't, by the way, of the 38% of food that's wasted, my job focuses on the 14.2% that comes from manufacturing food waste. And really, I'm here to reframe waste, because I'm a biologist, a scientist, an innovator first and foremost, and when I see manufacturing food waste, what I see is nutritional treasure. And I think if you speak to a wide range of cultures about food, actually they treat food like treasure, and they give food dignity. And I see upcycling as, because upcycling essentially is reutilizing and reusing food waste, I see upcycling as a way of giving back to that food dignity and creating food sovereignty. So I always start my talks here by talking about treasuring food waste. And I would not be doing what I'm doing if it wasn't to create more accessible nutrition. I'm not interested in utilizing food waste to create a snack that costs $8.99 in a laminated pouch, because that's not going to move the needle. And this isn't going to help these two ladies do their job, right? Because most of the people that they work with can't afford that kind of food. Which is the forward button? Sorry. Oh, here. Sorry. So these two numbers are, I always use these in any presentation because these two numbers are my why. And these two numbers you'll find on Refed's Insight Engine, but also in others. So the 145, that's 145 billion meals worth of food that's wasted every year. So obviously I'm pushing on an open door here because we're all working in food waste. We've collected here because we are bothered about it. But often I talk to people in other parts of the food industry who actually frankly aren't aware at the magnitude of the problem. And I think if you're talking to lay people, so people who aren't in the food system, this number, obviously blows their mind. Because we're humans, and nobody wants to really admit that this amount of food is wasted. And then the second number, 44 million, that's the number of people who are food insecure in the US. So the math ain't mathin', right? So clearly we, all of us here who are working in the food system, need to do something different. And this is the thing, these two numbers are what drives me to do what I do. These are the two numbers that make me want to reutilize and reuse food waste that includes nutritional gold that could be back into food products. So for those of you who aren't familiar with upcycling, the definition of upcycled food is that we're elevating food that would otherwise go to landfill to its highest and best use. So it's a no-brainer. Why wouldn't you take that and put that back into delicious, nutritious food products? This is the company I work for, Upcycle Foods Inc. This is our core ingredient. This is a flour that comes from saved grain. Y'all in the United States like to drink a lot of beer. There's more waste grain in this country than we know what to do with, right? So when investors and partners, they come to me and they talk to me about the security of the supply of saved grain, I go, wait. There is no issue with there not being enough saved grain in this country. There's more saved grain than we know what to do with and can feed people. And this is what it looks like, because also other people ask me, what does an upcycled ingredient looks like? And this is what it looks like. It's full of fiber and it's full of protein. This is gold, right? And this is core ingredients to feed people with sustenance and nourishment, to support their gut health, to make them feel full, to make them feel hungry for longer, to make their brain work so they can go to college and get really expensive degrees. All of that, but great degrees so that we can nourish the future generations, so that they can then become future doctors, the future Wendy's and the future Emmas, and so on and so on. So why would we put this in landfill? Why wouldn't we rescue this and put this back into human food? So another thing that people ask me is, because people are worried about ingredients that come from waste, right? And certainly that ingredient is a little bit darker. It has a little bit of a different taste versus your standard all-purpose flour. So I show this picture to show you that this is Chef Michael Ayub. He owns a pizza restaurant in Brooklyn. I encourage you to go. It's a really great restaurant. But this is a pizza base made with our Supergrain Plus flour. We need to not be scared of including upcycled ingredients in our food systems. There's a certain, and I understand the fear. I've worked my whole life in big industry, so I get it, because big industry thrive on making products that are extremely consistent every single time they make them, at high efficiency, at low cost. They're the same size, quality, taste, texture every single time. So any deviation from that is concerning. I get it. But we have to work together to explain to people that food doesn't grow in a straight line. And so some small changes from batch to batch is perfectly okay. It still tastes good and it's still nutritious. And I realize that's a long way to go. We've got a long way to go, and we're starting with ugly vegetables and wonky fruit and things like that, and that's good, but we have much more to do when it comes to embracing upcycled ingredients in different food systems. But I use this picture to show you that it can look delicious, right? And it can be delicious. And I think also, as I said to you at the top of this, I'm not interested in creating food products that are only for a certain few. One of the challenges with upcycling ingredients is that some small investment is needed in order to process those ingredients to make them safe. And that does mean that in comparison, a Supergrain Plus flour will be a bit more expensive than your all-purpose flour. But I still think that creating products like these, which are accessible, culturally diverse, is really critical. So our Supergrain Plus can go into a naan bread, it can go into lavash, it can go into challah, it can go into a standard sourdough. So also the other thing we have to remind ourselves is that this is not just food for a certain section of society, but upcycled ingredients offer you an opportunity to create food for a wide range of people. So the one thing I want to leave you with is that at the moment we're sitting in a food system that started many, many years ago, probably the 50s, Food System 5. Food System 5 is high-speed manufacturing, high-efficiency, low-cost food that looks and tastes exactly the same way every single time. If we're really serious about embracing food as medicine, reutilising and reusing resources because it's good for the planet and good for people, and actually disrupting the food system, then we have to embrace Food System 6. And I'll leave it there.
Wonderful. So I have to say, prepping for this panel and speaking to all these women individually was incredible. They were really inspiring. And one of the things that I think is really important about food as medicine is meeting people where they are. And if you can see from all of the different panelists, they have different perspectives and they come from different areas within the supply chain talking about that. One of the programs we're working on right now is, doing the food lockers where they will be brought to and have people be able to pick them up at the time that they need them. We're delivering boxes direct to the doors. We're doing food pharmacy clinics within the hospital systems themselves to be able to pick up the products that are either shared through a food banking system or purchased through there. So those are some of the things that are happening today. I'd love to take a step back a little bit and understand, maybe Emma, I'll start with you. If you could give us a little history on what food as medicine has meant for the many years that you said you've spoken through this and where you see the innovation going within the sector.
Sure, thank you. Is that working? Yeah, so I think I got this question because I have the most white hair up here.
It's lovely white hair, Emma, though, but it's really good condition. I used to work in cosmetics, I can say that.
I feel so much better. So really, I mean, food as medicine is right now, the way the term is being used, and like I alluded to, it's a really broadly used term. But there also is very specific history, and probably you could do this better than I could, but the many food as medicine as a prescription, and especially as medically tailored meals prescribed, goes back to the AIDS epidemic. And so many of the agencies that are working within our communities right now to offer medically tailored meals came about because of, and in response to the AIDS epidemic and needing to supply home-based meals to those that were suffering. And so, so I think just to, to underscore that sort of prescription dimension to food as medicine, and to help you understand that that's one very dominant space right now. And there's just been a lot of movement in that space, and in working with insurers and working with federal insurance companies, so Medicare and Medicaid services, to cover food as medicine or food is medicine, and it gets used either way, for patients. And so those prescribed nutritional programs are really on this, the upsurge right now. Most of them, there's like a waiver system that states can use to cover these programs right now, and that out of Medicare and Medicaid services. But that, I think, probably in the next 5 years or so, we're going to see these as prescriptions that are reimbursed directly and don't have to go through these state waiver programs or private insurance. But having said all of that, one of the things that our organization is really keen on is finding ways to bring good food purchasing to these programs. And so how are we incentivizing the providers of these programs to also be sourcing from local producers, to be sourcing from ethically produced products, and production systems that have organic and regenerative practices. And so to do that, there's going to need to be incentives. There's going to need to be the allowance of cost to cover those types of ingredients. And whether they're upcycled ingredients or direct, they cost more. And so we need to invest, if we want to take advantage of this opportunity to really move both needles forward for health of people and health of planet. I think we need to connect the dots between those purchasing standards and this opportunity. So that's where I'm hoping it will go.
So, and I want to hear, Wendy, your opinion on this too. It's interesting you say that, though, about paying, and that, because at the end of the day, my work is all on how do we get growers to take the excess produce off of their farms. And again, it's this new area of food as medicine that I truly believe is going to increase consumption and then be a place that we can get demand to make that happen. And so I think we have to give incentives to the buyers, but we also have to incentivize throughout the supply chain and throughout the value chain to really make this a new category to increase. So I love that.
And if I can add just one thing. A lot of these programs right now, they make their bottom line on philanthropy. So there's a lot of philanthropic dollars that are are kind of uplifting and making the food as medicine space possible. That's not, that's not a good long-term strategy. And so we need to figure out how can our policy bodies incentivize, insurance companies incentivize these sort of relationships and collaborations.
Amazing. Wendy, love to hear your
Right. Well, I think it gets back to let's find out who all the stakeholders are and asset map and bring them all together and solve this challenge. Because I agree, food is medicine, food as medicine is, I like as medicine, because I think if we medicalize food, then it becomes something, again, that is owned by the medical group, which is really, I think, unfortunate. Food is so much more than just medicine, right? It's our culture, it's our enjoyment, it's what we like to do with our friends, it's history. There's so much to it. But to get back, the food as medicine also is very dependent on who is delivering in the medical world, the doctors, the nurses, the dentists. And so, for instance, our kitchen that we built is training our next generation of healthcare providers to really appreciate food and what it has to do for themselves, but also it's being integrated into their education around what they can do to prevent disease and how they can use food also to help treat. And it was nuts for me to see how 2 medical students I was teaching didn't know how to crack an egg. I mean, it's just, so we need to be almost going back to the basics for even these very highly educated individuals. So there's all these pieces to it. There's the policy, there's the healthcare insurance plans, there's the, the people that are receiving the care and appreciating that they're being heard, because most patients come and want to know about food and how it relates to their health. Most of them do. They know it's not healthy what they might be eating, and that gets into the food insecurity piece too.
Totally.
And then that gets into the food recovery piece. I mean, that number that Lara showed, this disconnect. We have so much food being produced, and there's so many hungry people in our country. There's something messed up about that. But it's the knitting it together, I think, that the secretary talked about this morning. All of these things can be solved. It's just a matter of really pulling people together and making that a movement.
And I think we need to add to that list that we were combining the pharmacist and making sure that the pharmacists are the ones that can talk about it when they have it, and even if they need to be incentivized to be able to get programs together to get people to do that. And we also talked before about medical students not knowing how to crack an egg, but also don't get enough training in the traditional sense.
I was going to say,
nutrition.
surely there's a bit missing that we need to do more in terms of educating children and students and on nutrition. Generally, I think that the number of grown-ups that don't know a lot about nutrition is quite alarming, actually. And also, we need to meet them where they're at, right? Because I think we have to take into account where people are getting their nutrition education. And our young people aren't getting nutrition education from the doctor; they're getting it from TikTok. So we have to face into that, right? And so and meet them where they're at.
Totally.
One thing I would recommend, if you aren't aware of it, is that Food and Society Aspen Institute just published a really good Food as Medicine updated material that actually outlines all of what we should be researching. And there's a few things I think I need to add to it, so I'm going to call them up and let them know. But for sure, it's really well done, and it has a history of it too. So that's really nice to sort of see where it evolved from the AIDS movement and so forth. So
I love that you brought that up, because I think that there's so many different people working, and we talked about this too, but like, how do we bring these different silos together? And part of the work we're doing is to take other hospitals outside of just UT Health, and now we're moving into Chicago to do like studies for large with the same data accreditation and all those different things. So the more things we can do where we can add to the existing infrastructure and pull it together is amazing. We have about 10 minutes left, so I want to make sure if anyone has any questions that you can get. Oh, we have more. Sorry, I got confused. I couldn't read the sign well. Okay, we have 10 minutes till Q&A, so I'm going to keep going. Okay, great. Sorry, I got nervous. I wanted to make sure that we're on this thing, because I know this is a newer topic for some people, and for some, they just want to ask their questions. So wanted to give you that Q&A. Lara, let me ask you, in what ways do you think upcycling process can be improved or expanded to further align with the principles of food as medicine, and just your ideas in general of how the two can align?
Well, I think it's a bit of a chicken and egg situation that we're facing in upcycling. So one of, I think, sort of emotionally and pragmatically, people can see that it's a good idea to reutilize and reuse food that has value and put that back into food systems and use that to fortify food and meet them where they're at. So if it's going to be a pizza base, have a pizza base with extra fiber and protein in it. If it's going to be a cookie or a piece of bread, make sure that it's fortified with an ingredient that is good for them but also is good for the planet. I think the challenge is that obviously in order to create those ingredients we need investment. And so that means that the cost of the ingredient per pound versus its equivalent is more expensive. But if we get scale and if we get volume and we get a wider range of adoption, then the cost of those ingredients and our foods will come down, and they will be parity, or even potentially in the future maybe even cost less than their equivalent. It's just that the upcycling movement, the use, and upcycling of course is only one enabler to tackle food waste. There are many others, but upcycling is a relatively new movement and still needs people to join the movement and engage with it and understand it and educate around it so that we get more people to adopt it. I think nobody is in the upcycling movement because they just want to be in the upcycling movement. They're in it because they have purpose, and they're in it because food waste is, and we heard about it today, so I'm only preaching to the converted, one of the single biggest contributors to greenhouse gas emissions. So why wouldn't you want to tackle that? And there are all these hungry people who need more food. Why wouldn't you want to be part of the system that helps that? The only thing I will say is that as someone who works in the food system at the other end, my hope is that we are in a system where people don't have to go to the doctor to get a prescription to get good food. And I applaud, and I think the work that both Wendelin and Emma are doing is amazing, but I want to be in a world, in a country, where actually that kind of food is just simply available to everybody. And that's why I continue to do it. That's why I continue to work on upcycled ingredients, because I believe that there's a way forward where it can be. I might be only one person who believes that, but I will continue to do that,
Well, I think that goes along with the idea of education, right? And educating people on the health benefits where people can buy, but have access to buy it as well. Moving into that, I would love to ask you, Wendy, how can we better educate the public about the importance of food as medicine and its impact on our overall health? And how do we begin to encourage behavior to change so consumers do that on their own if that product is available for them to be able to purchase?
Well, I'm putting my pediatric hat on, because that's, as we know, our behaviors are very influenced by how we're raised, and also parents are very motivated and often will change their own behaviors. The mention of school, the secretary mentioned that this morning. Children are now in preschool, they're even in daycare. There's so many places along the way and the path that we have the levers to influence and create what we call make the healthy choice the easy choice. I'm part of an NIH study right now where we're testing how we can remove sugared sweetened beverages, including high fructose sugar drinks in different preschool settings, and also influencing their parents. And it's working. It's beautiful. Our preliminary data is just showing great changes, because everywhere the child is present, there is a healthier choice. So, yeah, they can go out and have some sort of sugar drink at a restaurant. That's okay, right? But it's not having it so easily and part of their whole life. So creating the healthy choice being the easier choice, doing that kind of manipulation, teaching the doctors how to promote healthy habits with their patients. The best doctor to be promoting that are the ones that practice themselves. That's why we work on the well-being of our medical students and our nursing students and our dental students and our public health students. We don't have pharmacists we would if we did. We would do the pharmacists too. But we just view all of our college students at UCLA, grad and undergrad, as the future leaders of this world. And they're actually two, I don't know if they're in this audience, they've heard me so much, they probably are somewhere else, but I ran into them at this meeting, and they're, one of them's working for Congress and one is working for a sustainable grocery chain. So these are the products that come out of a setting where you've got those kind of opportunities and those role models, and it just sort of filters through. It's a long game. That's the thing. It's a long game. And when I was going to go, I knew I wanted to go to medical school since I was 7, and I started doing research in a lab with a bunch of exiled Chilean doctors in college. And they kept saying, all these medical doctors here in the United States don't know anything about nutrition. This is terrible. And a lot of the sentinel studies that went on in Chile in the 60s and 70s and early 80s. And so they were really well versed in it. And I said, okay, I'm not going to be one of those doctors. I don't want to be one. So I went and got my master's in nutrition before I went to medical school. But I was one of the few, and it's still that way. So this is something that we have to infuse into our system, and we're working on those competencies right now to create competencies in medical school and residency for doctors and other healthcare providers. And Harvard Law School is part of that, and Harvard School of Public Health, Medicine, and there's a consortium of doctors across the country, including from UCLA.
That's amazing. Emma, can you talk to us a little bit further on how healthcare providers and food service industry can collaborate to reduce food waste and improve patient nutrition? I know you touched on it, but I'd love some practical takeaways that people can think about.
Yeah, I mean, I think you can see from sort of the guidance that we provide to the hospitals in our network that it's pretty integrated. We try to kind of emphasize that this is a sort of a holistic strategy that they can take within their food service operations and within their institution to be simultaneously addressing sort of their environmental footprint and their community health programs related to food. So the obvious one is the food, recovery, and from dining services, how can food be recovered and redistributed for community use? And I'll share one example. We did a pilot study a couple years ago with a group of 10 different hospitals, a system, Sutter Health System in California, and 10 of their facilities. And we worked with them over a 12-month period to redistribute 65,000 pounds of food to over 40 area organizations. And so this was, it was a concerted effort. It did take some additional training and technology and building relationships with entities that could help them redistribute, and also community partnerships. But it was it was supported up and down from, it started in the food service operation, and it became really embraced by leadership in the organization. And so I think that's a good example of what can be done, and we're working to really scale that practice throughout our network right now. So recovery redistribution is one big area, but also thinking really simply and upstream within the hospital, thinking about the back of the house, thinking about how if you're preparing really healthy, nutritious meals, you're going to have less waste, right? People are going to be eating what's on their plate because it tastes good. And so we really promote a whole food, plant-forward cooking strategy, and I think that really ties in well to reducing waste, as well as just lots of back-of-the-house strategies just for reducing waste. And so that's where I would focus. And so if you don't know if you work in a healthcare setting or work with clinicians, tell them, get involved, go meet their food service director, and make connections and make connections between the healthcare food service setting and their community health offices, because often those two silos don't really communicate, and there are real opportunities for synergistic sort of collaboration.
So I guess my other question to ask is, if people wanted to walk out of here today with some resources, we talked about the Aspen Institute, we talked about some other working groups. What are the groups that you guys would suggest, and what type of materials do you think are great next steps for people that are interested?
Well, I really think if you can find a food forward in your neighborhood or in your community, that kind of organization, because their work is that they rescue food and then they bring it to distributors like our clinic, like our food banks. I mean, over 80 million tons last year was recovered just in Los Angeles and distributed to Los Angeles, Valencia, and some other places. I know New York has one. I forgot the name of it. And what is it? Harvest. Yeah. Yes, exactly.
City Harvest is
City Harvest, exactly. There's City Harvest, and I also know Food Forward has a sort of a guide of how you could do it in your own community. So if you don't have one, look at their guide and you can replicate it, because think about all that fruit and vegetables that are just going to waste, and it can move to some space that could then distribute it. I really, all the food insecurity that we have on our campus, we're going to be bringing in more of those fruits and vegetables just to give these students a chance to be able to then not have to choose between rent and a meal.
Amazing. Emma, would you have any to add?
I guess I would add, there are some national organizations, food as medicine organizations. There's the National Food as Medicine Coalition, FIMIC, and you can find them on the website, on the Google. Yeah, I mean, I think there are a lot of organizations that are working in food as medicine, and they're working to set standards. It really strikes me as an opportunity to set standards that include upcycled food. I mean, I think about how, we wouldn't have recycled content in our plastic if we hadn't had standards that had pushed for it.
Exactly.
So that's an exciting.
The Ellen MacArthur Foundation is actually running a big food redesign challenge at the moment, and we are part of that because one of the criteria is to demonstrate to people that you can create good food using upcycled ingredients. So we have a product in that challenge. I would encourage people to go to our website, upcycledfoodsinc.com, and also look at the association website, which is upcycledfoods.org. I know it's confusing, sorry about that. And also, if you are interested in doing upcycling in your community, then just find me on LinkedIn, because I have recently been talking to the city of LA. Actually, the sanitation works department found me to talk about upcycling, which I think is a big yay. And I'm happy to provide my expertise and support if you want to create some circularity in your existing community as well.
Thank you. That's one other recommendation too. There's a teaching kitchen collaborative that you could join, and many people are part of it in this room, and we're part of a randomized control multi-site trial looking at food as medicine for people that are adults who have they have other conditions, other health conditions. So we're going to see how it works, just to learn if they're just learning how to cook, and with healthful ingredients. We're going to be looking over a year to see how they do. We're halfway through our campus. UT's one of them also, so is Dartmouth, and so is University of California, Irvine. We're the four sites in UCLA. I would also, I interviewed a couple people on my podcast about food as medicine. I don't want, it seems like full disclosure, there's no money around it or anything. It's just, I interview. So if you look up UCLA Live Well podcast, you can get it on your, Spotify and, Apple. But there are a couple of interviews. One of them, the head of the Food and Society Aspen Institute. So if you want to listen to something while you're running or walking or,
Amazing. All right, well, now is the right time for Q&A. So if anybody has any questions, yes. I can answer on a supply side, but I'll let somebody answer on a medical side first. Does someone want to answer on that first? She's the doctor on the panel, but I will answer.
I'm a pediatrician, okay? The medically tailored meals are based on science that has been studied. Now, I think there is a good point, and I think it's important to realize that a lot of studies there's not, some populations are not as well studied as others. And so that's something that needs to be worked on across science. There needs to be, there are less women in studies, there's less different, race and ethnicities. So that's something that I know people are working on. at the medical side, and very hard, working very hard to make sure that there's representation of all different populations in our studies. So, but the studies that are there, that's what are being developed, and also that's why the Aspen Institute created this report this year, is there's a lot that needs to be studied. So there's a lot of opportunity to study as well. Not that people will be guinea pigs. I mean, our randomized control trial right now, we're using food, so it's not like we're using like medicine. So people could eat this food anywhere. They don't need a prescription for it. I mean, honestly, I'd prefer not to have prescriptions. I'd rather have people learn how to. But that's what we're right. But that's what we're trying to teach, right? Or see if it works.
I think just to add on that on the supply side, so like we learned a lot through the pandemic too, and there were box programs and people, like again, not medically, but just on supply. And one thing I did one time was I brought collard greens into a community and everybody threw it on the ground. And then I went to a different community and they all ate it. And so it's not only, and then we moved bok choy into that community. So it's about choice, it's about figuring out scalability, it's about the dignity. In my program for Food is Medicine in Houston, I bring flowers in the boxes along with the produce, and we're looking at the mental health of what that does, and we're doing all the different experience shares, and that has done a lot for mental health for women that are high-risk pregnant women that can't leave. So it's the dignity. So I think there's the side of choice of what people want, and I think there's the other side of it of what actually is going to help the ailments as well. So both are important. Yes.
Do you still have home economics in school in the US? Because we don't in the UK anymore, by the way.
What's resulted is we don't have a population that's educated about food, right? And that's kind of, like, maybe it shouldn't be home ec. I think that was seen as kind of almost a sexist type.
Yes, yes.
Structural sexism, which I would tend to agree with. But these things can be integrated into the curriculum at a deeper level. And I don't hear anybody talking about it.
But biochemistry could be easily integrated into chemistry as a subsection of chemistry.
Right on.
So
I agree.
We all agree. We all agree.
And this is amazing, but you guys, we have ended our session. I'm so sorry. This was an amazing, lively session, and thank you all for coming. And we will be around to answer any other questions, but we get more time another time, hopefully. Thank you, guys.